Hi, my name's Alex Ryan, and I was asked by my group to give this talk earlier in the year as we transition into a production-based payment model. I have a reputation for being a very fast reader, but I think it's worth pointing out right away that that's a bit of a dangerous mislabel. I don't read faster than anyone else, maybe a little bit from very focused search patterns. I worked nights for 4 years, and it was sort of sink or swim, but most of my speed increase comes from the time around the reading. 1,000,001 little ways of getting everything around the reading time to be more efficient, and that's where I get my time savings from. The goal of this talk is to teach you those tips and tricks, or at least share ideas with you. There's something funny about efficiency, though, which is that if you're really motivated to be efficient, you're probably more efficient than I am. And if you aren't motivated to be efficient, if you don't want it, then all the tips and tricks in the world aren't going to make any difference. Here's the thought experiment. If you had to increase your RVU per hour by half an RVU per hour per week for 8 weeks, so it's a total increase of 4 RVU per hour average increase, which is pretty significant for most people, or you would be eaten by a pack of velociraptors, then I guarantee everyone could do that, given 8 weeks to do it. And I'm sure you'd find all sorts of tips and tricks that I've never even thought of. We had an experiment in our group called routine support. We had too many routine cases, and we paid people hourly during the day, but then we would pay you by the RVU in the evenings after shift. We had one radiologist who was kind of famously slow. He'd do about 5 RVUs per hour until routine support hit, when he would suddenly rocket up to 14 RVUs per hour. So this shows you that the capacity to work really fast is there. There's a problem, which is that a lot of the way he achieved that increased speed was by decreasing his reading time, his interpretation time, and so his quality went down, and we had a lot of quality issues with that, which is understandable. When you just drop someone in the fire like that, what else are they going to do? Learning to be efficient is an investment. It takes a long time. The goal is that once you learn all those tips and tricks, it doesn't cost you anything to use that efficiency. You aren't compromising your reading, your interpretation time, and you aren't just focusing so hard that you're going to exhaust yourself, and that'll be the theme of this talk. I knew a guy who had a job, I think it was Kodiak Island, 6 months on, 6 months off, crazy amounts of money and crazy amounts of work. And he said the trick is never compromise your interpretation time. Everything else around it gets tight, 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 but never cut into that. Carl Furman was a sainted chest radiographer, radiologist in the University of Pittsburgh, and I was anxious about private practice, and I said to him, how do I do it? He said, it's mostly about focus. So I like to look at this from these 3 colored blocks. There's X factor, which is time spent at work not actually doing work, wasted time, but we'll talk about that. There's tech factor, which is interacting with all the systems that you use, and then there's the interpretation time itself. So the question is, can it be fast and accurate, right? The guy from Kodiak Island was talking about tech factor. How do you use the systems more efficiently? And Dr. Furman was talking basically about X factor, just focus harder. X factor is funny because it's wasted time, but you need a certain amount of it. If you strip it completely away, you're going to get burned out fast. I've been there. I know what it feels like. I can completely not waste any time at all for a few days, but it is absolutely exhausting. So you need a certain amount. The irony of me giving this talk is that I'm a bit of the ADD type. And so if you put me in the clinical setting, I get to know everybody in the hospital, and I'm always telling stories, and they all want to talk to me, and the phone's ringing. And I tend to get kind of distracted. I used to do a lot of looking at these things, and I'd see something that looked like a whatever, and I'd go looking for the Google image. And the point is that I'm not the most focused, or I'm super focused. Those are my two modes. So how do you sustain increased production without lowering your quality or burning out? Well, if you're in an incentive model, that's the motivation, right? You can't mess with your interpretation time. You can squeeze out a good amount of X factors, so you're not just staring off into space. But the real thing you can crunch down on is tech factor. And that's what we're here to talk about today. So, efficiency tips and tricks with Alex Ryan. Many of the tips in here are specific to our system, but I hope you can find corollaries in your own system so you can use the ideas. And many of the ideas are universal anyway. So let's get to tip number 1, which is the most important, and it encompasses everything else we're going to talk about, and it's this: don't stop. Find 1,000,001 little ways to not stop when otherwise you used to stop doing the work and instead are doing inefficient things. Let's talk about some examples. The most obvious, of course, is X factor time. Staring off into space counts as stopping, playing with your phone, being on YouTube, whatever. Of course, you need a little bit of that to keep your brain fresh. If you've been grinding for 2 hours and you need 5 minutes to shake out the DVTs, that probably doesn't count as stopping. That's a necessary X factor time. But if you read one case and watch YouTube for an hour, that's stopping. Mouse aiming and clicking. We had an administrator who was all about reducing the number of mouse clicks in a day, which was interesting because clicking a mouse doesn't take essentially no time or effort or thought, right? But aiming a mouse does. We need to find that little checkbox. It takes foveation, it takes fine motor, it takes a lot of little bits of effort that one time is irrelevant, but add them up 1,000 times a day, and suddenly, if you can take all of that out, it saves you a lot of time that you didn't need to be extra spending that energy. Kind of like when you're moving, putting something in a box is easy, but deciding what goes in the boxes is just slaughter. Should the soup cans go with the sweaters? Should the player go with whatever? If you've moved recently, I'm sure you can sympathize with that one. Overlapping slowdowns is an example of not stopping. If your images are loading, don't just sit there and wait for it, and then go set up your report. As soon as you've got them loading, go set up, put in your dosage and your sides and whatever you need to do for your report so that you're always doing something and you're never just sitting there waiting. So otherwise, you've doubled your amount of time for no gain. If you've absolutely maximized everything you can possibly doing and it's just loading, okay. But if you give into the temptation at that point to be like, oh, I've got free time, I'm going to look on YouTube, I guarantee you'll waste time. These things will be ready and you'll be off doing something else. Be like a cat waiting for the mouse to come out of the hole. Just wait in total focus and then pounce as soon as it's ready. And that's one of the keys. It's actually a surprisingly important key to maximum efficiency. Just that one shift that one change during your shift can make a huge difference in how much you produce by the end of the shift. Screen column and organization. The more time you spend clicking back and forth through windows and screens when you could lay it out efficiently so you don't need to do that, so you can get right to, so you can look and see your information, so you can get right to the thing you need to click, that adds up a lot. And similarly with your mouse and keyboards, the more things you can put at your fingertips in the mouse or like near your hand on the keyboard with easy key commands, that's a lot of saved time throughout the day. Tip number 2 is specific to our group, but see if you can at least use the idea. We have something called the information window and the matrix window. And by default, they're on top of each other, so you have to click back and forth throughout the day. And I've watched other people click back and forth. And so every time they need information, it's hidden. And they have to click something to pull it up, and then click something else to pull the other thing back up. And that's a lot of clicks you didn't need to do, and you can just lay them side by side. And I've always laid them side by side. And other people balk for some reason. Wow, things are scrunched. But I've been doing it for 10, 11 years, and it works better. So you probably don't have that exact situation, but maybe there's something like it you haven't thought about that you can lay out a little differently and save yourself some time throughout the day, throughout the year. Tip number 3 is kind of a multi-part tip. This is how I approach a study when something pops up. First thing I do is image hanging. I'm extremely aggressive about this step. Like a fighter pilot, I dial in to get my things laid out, axials, sagittals the way I want them. And that's something where you can go as fast as you want and you won't cause the patient any harm. Do it as quickly as you possibly can, and that times 100 cases a day is a lot of saved time. Next step is start CineLoop. In our system, if you're actively trying to scroll a CT or anything, that's a stack like that, it'll load first. It'll cache that one first. So I start CineLoops on all the things I want to see, and it loads those earlier than the other ones. Now, of course, if you're trying to load everything at the same time, that doesn't help. But if you happen to have a situation similar to ours, then that's a really powerful thing. In fact, what I'll do is I'll hang them, I'll get the CineLoops going, and then I go to my report and I start filling in ISOView and whatever and setting up my macros. Task overlap we talked about. Do your report while the things are loading. And then sync groups. I remember when I was in residency, there was an attending who was a 2 comparison study. He'd scroll one, scroll the other, scroll one, scroll the other. And I said, why don't you just sync them? And he goes, I don't need to do that. And it was so funny because it was an example of kind of an academic setting where efficiency didn't matter. So why would he bother? But it seems so strange to me when it would just save you the trouble. I've always been kind of obsessive about efficiency. Anyway, this all comes back to tip 1, which is don't stop. Find ways to not stop. And it's amazing the difference between not stopping and kind of not stopping. For myself, when I'm mostly not stopping, it's versus absolutely not stopping, it's about a 25% difference in productivity for the day. It's amazing how those little bits add up and steal your efficiency. Macros are so powerful. We have structured reporting. But I'm very specific about how I use my language, so I'm always changing things in every single report. And I finally said, this is ridiculous. Let me just set one the way I like it, and then I can swap in the findings section and leave all the other stuff that our IT people set up. Just the findings and impression with my language every time. Now I have like 75 or maybe more, I don't know. Looks like 85 of the last count there. Of these, for almost every study, I have my own version of the template, not trying to break any rules, just my specific language, and I just swap it in. I'll highlight it, say insert CT abdomen and pelvis, and it pops it in. Super quick and easy. But the real nimbleness of macros is that, say you've got a CTA head and neck, but they already did the head CT, so it's not including that, and your template doesn't map that. So I've got a macro that says head reviewed separately, instead of having to delete the head section or whatever. That may be different in your group. I have something that says findings were called at the time of interpretation. It's just a mouthful. I don't like saying it. And so I can just say insert findings and save myself that extra bit of verbiage. Pediatric bone x-rays, growth plates, joint spaces and growth plates appear normal. It's just a lot of words. So I say insert growth. I have a million of these. KUB lines tubes. So I really hate it when the template has a lines tubes and the answer is no lines tubes. It'd be like your 10th grade English teacher saying, let's include a paragraph that just says nothing, has no meaningful information. Like, that's bad writing, so I hate that. So my regular KUB just doesn't mention them, and if there's lines tubes, then I have this macro I can pop in that has that section. And then usually has, enteric tube terminates in the stomach or whatever, because 99.9% of them are like that. Laceration, the impression reads, no osseous injury or foreign body identified, my language. No acute abnormality identified. I can just say insert no. I say that a million times a day. Normal mediastinum, they required recently that we mention coronary artery calcifications, which I'll always forget if they aren't there. So if I have a young person, I just say insert normal mediastinum, and it says all the heart and the vessels and the lymph nodes and everything, and the coronary artery calcifications, and I don't have to say any of that. Specific arthritis patterns in shoulders, I just find tiresome to say insert shoulder, and so on. The delete key I find very useful when I'm editing. A lot of times highlight and delete things, so I tag that to my mouse. So far I haven't got anyone to sign on to this idea, but I find it absolutely necessary because I do so much trimming, I guess. So that's just one idea. It goes back to the shoulder thing, having to reach over every time to hit delete. It's a lot of muscles, surprisingly, to engage just to lift your arm. Arms are probably pretty heavy, and lifting it, moving it, again, one time doesn't matter, but 100 times a day it adds up. Same thing for left and right, moving among different studies in the same images in the same study through plain films or a CT series. I have that tagged to my left and right arrows, and I put that on my mouse keys also, so I can just flip through those without having to touch the keyboard. Tip 7, in our system we have these little columns of information. You can tailor what you do and don't want to see, and how big they are, and where they are, and what order they're in. And instead of having to scroll around every time hunting for what you need, if you set it up ahead of time, then you can just see everything you want within the window and not spend time hunting around. Tip 8, so we have an options menu that's really deep. If you have something similar, it's worth getting to know it. And I'll give you some examples why. Grayscale presets. You can set the presets to just what you want, and you can set them to the control keys you want. By default, ours go on the F keys along the top of the keyboard, but again, that's a shoulder issue where you have to reach over and hit them all, where I put mine on the right side of the keyboard, so I can just kind of pivot my wrist over and hit them. Some people put them on their mouse. I haven't chosen to do that, but I could. Just an example of little bits of time saving through the day. The mouse buttons is really interesting. What does your mouse do when you hold the left and right buttons down and scroll around? What does it do when you hold the right button and the wheel down and scroll around? What does it do with all those other combinations? If you haven't set those and you don't know exactly what they do, there's so much power you can get without having to do other stuff. You can do it all from your fingertips with essentially no motion. And so going through and tailoring that is a great idea. It's a very powerful thing. Tip 9 is AutoNext. This is my absolute favorite efficiency tool. And maybe your system calls it auto load or auto whatever. It's whenever you finish one case and the next case just pops up. What's so powerful about this is that you have to choose to stop working. This is in contrast to when the regular list, you finish a case and you just have the list again. And if you don't do anything, nothing happens. And you can look at the list and go, man, I need a breather. You can look at the list and say, I don't want to read a runoff right now. Maybe I'll read a chest x-ray, spend time thinking about it. You can look at it and think, I don't want to read that study, but I don't want people to see me not reading from the top of the list. I'll just wait till somebody else picks it, and then I'll take the next one, et cetera, et cetera. All of that is wasted time and energy. When you're in AutoNext, none of that happens. It's just the next study just pops up. You don't have to think. You don't have to make choices and wonder and space out and any of that stuff. You just the next study. And it's been shown again and again to increase efficiency a lot. When it first came on, I was 100% adopter. I think the next most common user used it 25% of the time, and I've just been absolutely devoted to it from the beginning. For me, and partly because I will space out otherwise. I'm the worst space router maybe you've ever met. And so I really rely on these tools to be super efficient. It can be fraught with nuisances. Breaking an AutoNext chain is kind of a pain, and you have to learn all the little ways around it, but it's worth the effort. This is a great tip I learned just recently. Sometimes patients are like this or like that, when they're in the scanner. It doesn't seem like it'd be a big deal, but it's kind of like if you were driving and you tipped your head to the side, it would be really disorienting because you're used to seeing everything in a certain orientation. If you can find a way, shift option, click and drag is what you can just rotate. If you have some option like that, learn it because it's wonderful. It's a surprisingly powerful time saver. All of this boils down again to just all these ways to not stop. And again, little differences in not stopping can make a humongous difference at the end of the day in how much you've actually produced. The final topic here is interpretation time, and I'm reluctant to get into this because it's so personal for people and so specific to your kind of work and your group and so on. But I'll give you a couple just thoughts that I have on how I do this. I worked ER nights for a long time. It was sink or swim. And so these were the ways that I found to tune up my interpretation time. And the first is just a search pattern. I'm extremely aggressive about my search patterns, and I do it exactly the same way every time. Organ, system, organ. And then I stop and I just look around to make sure that I didn't miss anything with my tunnel vision, just a general look around. Funny thing is I got called out recently for not looking at the history because I tend to do my search the same way every time, and then I look at the history. And then I kind of match up. It's a little bit of an internal test. Did I catch everything or not? And so I do that as an additional layer. Otherwise, I feel kind of primed by the history or distracted by it. So anyway, that's one of the things that I use to be fast. The second are focused impressions. Again, this is an ER thing. In my opinion, at least in ER, the doctor has one question and they want one answer. And my job is to give them that answer. My next job is to tell them anything else that they need to know that they need to act on, follow up or whatever. And beyond that, they don't want to know about it. Not right now. You can have the most horrific post-surgical stuff, but if it hasn't changed and they don't have to do anything about it, it just stays in the findings. I might give you a chronic findings as above in the impression, just to say that there's some stuff up there, but don't worry about it right now. I understand that in other cultures, oncologists want to know more and so on, but it's something to think about at least. If you really think about your audience, who's your customer? What do they want to know? If you give them 27 impression points in the ER, they're going to be lost because they're going to now they have to decide which of those matter and which of those don't. And they're reading through, what on earth is a phlebolith? Do I need to call on the surgeon for that? So as much as you can make their job easier by giving them exactly what they need and nothing more, it'll help efficiency for them and for you. So that's all I got. I hope this is useful. If there's a way to reach out to me and ask questions, feel free if you do. Otherwise, thank you very much for watching.